We're going to Nigeria, where Kyla Megwa, presenter, producer, reporter, and State House correspondent for Channels Television, joins us via Skype. So, hi, tell us, what are the latest figures from your country?
Thank you so much for tuning in, for speaking with us this afternoon. It's a very interesting day. Just this morning, we got 6 more confirmed cases. So let me just give you a breakdown as to how many cases we have in the country at the moment. So we have 36 confirmed cases of COVID-19 in Nigeria. 33 are active, 2 have been discharged, and we recorded the first death today. So that has been something that's caused a bit of worry around the country, especially since that death occurred right here in the nation's capital, right here in Abuja. So let me give you a spread as to how the infections have been going on. In Abuja, we have 6. In Edo State, we have 1 person with COVID-19. Ekiti State has 1. We have 2 in Ogun State, 1 in Oyo, and then the largest number, 25 in Lagos State. So that's something that's making the entire country worry about it. So that's the update. 36 cases confirmed. 26 of those cases have travel history with countries with high burden case of the virus. All right, and then we have 6 of those cases are from those travel cases, and then 4 from unconfirmed sources, which is a cause of worry, because we cannot tell where they got those ones from. Meanwhile, 32 patients are clinically stable. 1 person is dependent on oxygen. And of course, like I told you earlier, we had 1 person die this morning. And the person who died was actually a public official, so it's someone who's really well known. His family put out a statement. Now, the Ministry of Health has just finished the press briefing to update on all the situations of COVID-19 that we have across the country. And then, of course, the Minister of Information and Culture, Mr. Lai Mohammed, is saying that one of the problems is people are not self-isolating, and that is a big problem, very big issue. So they're saying that they're going to probably have to use the military to ensure compliance in that particular matter, because it's imperative that everything is done to, stop this spread as much as possible. There's a lot of social distancing going on in the country. So many rules are put in place. Schools have been closed down. Some universities have moved their studies online, which is also a very good thing, since there's social distancing now. It's important that education continues. So many schools have gone online, but schools have been shut down in the country. And then, of course, there's the fact that everyone is trying to comply with the rules and regulations for the times that we're in.
Kayla, what can you tell us about the 1 case that ended in death, the public official who passed away? Did he have any pre-existing conditions? What do we know?
Well, according to the Ministry of Health, they say he did. They say he had pre-existing health conditions, and that was the reason why when he caught the disease, he wasn't able to fight it off as many people with strong immune systems would have been able to. Remember that Nigeria has recorded 2 people who have been discharged. So there were people who had the disease. The index case, that's the Italian, and then we had another case not too long ago. So those 2 people have been discharged. So it is possible to beat this disease if your immune system is strong enough. But yes, like I said earlier, this 1 death that has been recorded is someone who they said had pre-existing conditions, and that's the reason why he wasn't able to beat it.
Now, you mentioned a number of directives that are being violated by members of the public, and there is a discussion now about possibly bringing in the military to enforce these directives. Talk us through the directives. What have the people of Nigeria been told to do and not to do?
All right, well, there's so many, actually, starting from yesterday. Many arrests were made yesterday because the rule was that there wasn't supposed to be any gathering of people above 50, at least any church gathering or any gathering at all of people above 50, 50 being the number of people that should be in a particular place. Now, that rule was flouted, I do have to say, by many congregations yesterday, and of course, the law enforcement agents were going around to ensure that that was stopped. At the time when church services were on. But I do have to say many churches did comply, but for the ones who didn't comply, that also had to be looked at very sternly by the security agencies. And then, of course, there's the fact that for buses, for instance, there's a sitting arrangement for a lot of these public transportation. So 1 person is supposed to sit in front, 3 at the back, and three at the other. And we saw today, even in the nation's capital, we were able to see some people flouting those rules, but we're seeing law enforcement doing what they can to stop people from breaking those particular rules. Now, the major one that the Minister of Information and Culture is most worried about is the fact that many people who come into the country did not self-isolate. Many people are not self-isolated, and in fact, there are about 1,300, he said, yes, about 1,300 people who are connected to some of the cases that we have, who they're still trying to get them to come in and report themselves, to say this is who I've been in contact with. These are contacts that they got from people who are already dealing with the disease right now. And many of those contacts are not making themselves available to be either quarantined or tested or self-isolate themselves. Those are some of the issues that we're having to deal with. And the Minister of Information was very stern about that today, saying that they're going to ensure enforcement, because this is something that we have to be together as a country.
Kayla, is Nigeria doing mass testing, or are you still testing those that only meet the case definition?
So there are calls for mass testing, but that hasn't started yet. That has not been done. There is no mass testing going on. They're doing the testing based on the information that they get from the cases that they're handling. So that's where we are right now, but no mass testing whatsoever is going on yet.
Okay. Are there concerns about supplies, medical supplies? Does Nigeria have enough of the test kits, of PPE for your frontline health workers, of respirators, and all the things that some countries are very concerned that they are going to face shortages of?
Yeah, that is a concern around the world. Nigeria is just one of the countries around the world who are facing that particular concern. We have 5 testing centers across the country, but of course, the majority of Nigerians are asking for more. The National Assembly said they wanted testing kits at the National Assembly so that when you're coming into the National Assembly, you get tested. There are calls for more. More needs to be done. There are many quarantine centers. Remember, this is not the first time we're handling something like that. We were able to handle the Ebola situation perfectly. But this is a little different. The anatomy of this particular disease is a little different. So it's something that we're learning as it evolves. Remember, the biggest problem with COVID-19 is the fact that for the first few days of infection, you may not show any symptoms whatsoever. And as long as you're not showing any symptoms, you are contagious. So contagious and not showing symptoms. And that is how it's been happening. It's not just in Nigeria, it's around the world. This is how people have been infecting. This is how they've been entering into countries. You may not even know that you have the disease because you're not showing any symptoms. And the machines at the airports and at the entry points of Nigeria look for the symptoms of the disease, which is what the Minister of Health has been speaking on, the fact that, look, we have to be very careful. So we're basically depending on people to do the right thing. If you came in from outside of the country, you should self-isolate. The daughter of the president is in self-isolation right now. The governor of Bauchi State was in contact with someone who has tested positive to the disease, and he's in self-isolation right now as well. One of the cases that really shocked the nation was when the presidential candidate of the People's Democratic Party, Mr. Atiku Abubakar, actually sent out a tweet saying that his son has been infected and has been taken away by the NCDC, for them to do, for him to be quarantined because he has tested positive to the disease. So this is something that we hope that everyone does the right thing. And remember, this is a disease that we're still trying to understand. So it's a very hard time, but if everyone is doing the right thing, then probably we will see an end to this pretty soon.
A lot of the violations that you described earlier are caused by economic factors. People just don't want to lose money, and so they end up doing the wrong thing, like overloading vehicles and still organizing events that have more than 50 people attending. How is the government intending to address this? Around the world, governments are creating incentive and booster packages to help businesses that are affected by the social distancing that is inevitable. How is Nigeria gearing up to do this?
Well, the country is doing what it can, considering the circumstances. Remember, this is something that's exploded so all of a sudden, sort of in our faces, despite all the controls that have been put in place. So the basic thing that is being done is to ensure that people do what is right, put social distancing rules out there so people know not to be in places that are overcrowded, know to sanitize yourself, know to keep yourself clean, know to make sure that children are doing the right thing. That is the education bit of it, I think, that the Nigerian government is more interested in at this particular point in time. There will be, like the Minister of Information was saying, if the compliance level is too low, then we might have to take other measures to ensure that people do the right thing. But as it is right now, it's the education bit of it that the Nigerian government is more interested in. And many Nigerians are on board with this. Just a few rogue elements who are breaking and flouting these rules. But we are hopeful that things will be done properly, and we'll see our country get back to where we want it to be. So that's the situation here.
We share that hope with you, Kayla. Kayla Megwa, thank you very much for your time with us. Now, Kayla, of course, is a journalist in Nigeria, giving us an update on how they are faring in the battle against the novel coronavirus. Right then, so let's very quickly have a look at what's happening around the world in terms of the coronavirus cases. We have 358,803 recorded cases as we speak. We're looking at about 15,433 of them have resulted in death. 100,645 have recovered. That number crossed the 100,000 mark today, which is great news. At least a third, a bit less than a third of those who have been affected have recovered already. There are 242,725 active cases. Now, here's how the active cases are broken down. Majority of them, 95% of the active cases, have very mild symptoms. They're in mild condition, about 231,512 out of the 242,000 total. Now, that means about 5% of them, 11,213, have serious or critical symptoms. And this has been the case. This statistic has held steady almost throughout the entirety of the life of this virus. So about 5% of those who get it suffer serious or critical symptoms. And of course, a smaller percent of those end up dying. All right, now let's have a look at some of the countries, and they are in sort of descending order of numbers. China still at the top, 81,093. But look at Italy, 59,138 cases recorded so far. They are closing in on China in a horrendous way. They've certainly recorded more deaths than China. 5,476 Italians have died as a result of the COVID-19 spread. Well, they're probably not all Italians, but residents of Italy. This is certainly a worrying number. The USA is very close behind, 39,371. Their epicenter is New York, unfortunately, New York City, where they are feeling the worst of it. It makes sense. They are the most populous state in America. So one of the most populous, states in America. Spain follows in fourth place with 33,000. Germany with 27,000. That's where Angela Merkel, their premier, is currently in quarantine. Iran has had a tough time of it. They are in sixth position in terms of number of cases with 23,049. But they've had far more deaths in Iran and Spain than in Germany, where they've had a surprisingly low number of deaths, 115 so far. France is not doing great, 16,689, worse than South Korea, which, as you recall, was one of the first countries to record large numbers, but they are now hovering around about 8,961 with only 64 new cases, 111 deaths only. So they seem to be holding fast and seeking to stem the tide and perhaps turn back the trend. The United Kingdom is right there with 5,837 cases, 289 of them resulting in death. They've had quite a surge with new cases, 154 new cases over the past 24 hours. The Netherlands is struggling too, and their healthcare system seems to be feeling the brunt of the new cases, they are also facing some shortages of things like respirators, which they never had many of to begin with. They never needed that many, but right now, certainly, with 213 deaths already, they are certainly in need of the best health care they can give to their people.